One kidney lies on each side of your vertebral column. The kidneys are the primary organs concerned with body fluid and electrolyte regulation. Unneeded fluid and ions are excreted in the urine. Also contained in the urine are metabolic waste products such as urea and uric acid, which form during the breakdown of proteins and nucleic acid. The combination of water, ions, and waste leave the kidneys as urine, which flows through the ureters and into the urinary bladder, which will store the urine until it passes out of the body through the urethra. A renal artery supplies each kidney with blood. The blood is distributed to over 1,000,000 nephrons, the functional units of the kidney. Nephrons are found in the cortex and medulla of the kidney. Each nephron is composed of the renal corpuscle and a renal tubule. The renal corpuscle has two parts, a spherical capillary cluster called the glomerulus and a cup-like container called Bowman's capsule, which surrounds the glomerulus. The renal tubule has three contiguous sections: the proximal convoluted tubule, the loop of Henle, and the distal convoluted tubule. Each renal tubule empties into a connecting tubule that leads to a collecting duct. Connecting tubules from many nephrons empty into each collecting duct. Blood reaches the glomerular capillaries through the afferent arteriole. Blood then leaves the glomerulus in the efferent arteriole, which supplies a network of peritubular capillaries. From the peritubular capillaries, capillary loops, the vasa recta, extend alongside the loop of Henle. If we think again of our recycling analogy, we can compare urine formation with throwing both garbage and unused needed materials into a bin, then taking back what we want to keep. Now, before taking the trash out, we add a final few waste items. Urine is formed in 3 steps: filtration, reabsorption, and secretion, which we will discuss in order.
Let's begin with filtration.
Blood pressure within the capillaries of the glomerulus is unusually high because the efferent arteriole is narrower than the afferent arteriole. This bottleneck effect helps to push water and solutes across the capillary walls and into Bowman's capsule. In doing so, water and solutes cross a filtration membrane consisting of the fenestrated endothelial cells, the lamina densa, and the slit pores created by the podocytes that cover the glomerulus. Blood cells and large proteins are too large to pass through the filtration membrane. As it travels along the nephron, the composition of the tubular fluid changes dramatically. Reabsorption is the second step in urine formation. Most reabsorption occurs along the proximal convoluted tubule. Reabsorbed material moves into the interstitial fluid and then diffuses into the peritubular capillaries. The last step in urine formation is secretion. Additional waste products are pumped into the filtrate. The DCT and collecting systems secrete acids, toxins, and drugs into the tubular fluid. Secretion occurs along the PCT in addition to reabsorption. By the time the tubular fluid reaches the collecting duct, at least 85% of the water and sodium ions have been removed for recycling. The tubular fluid arriving at the turn of the loop is highly concentrated after its journey along the descending limb. Unlike the descending limb, most of the ascending limb is impermeable to both water and solutes. Water is not reabsorbed here, nor can solutes diffuse into the tubular fluid. Sodium ions and chloride are the most abundant ions in the tubular fluid, and large amounts of sodium and chloride are pumped out of the tubular fluid as it travels along the ascending limb.
As these ions are pumped into the peritubular fluid, the solute concentration inside the tubule steadily decreases.
As the solute concentration decreases, fewer sodium and chloride ions are pumped out of the tubular fluid. Thus, the solute pumps along the ascending limb helps to create the concentration gradient responsible for concentrating the tubular fluid in the descending limb. This is a positive feedback loop. The pumping of solutes from the tubular fluid in the ascending limb adds to the concentration gradient within the medulla, which in turn draws additional water from the tubular fluid in the descending limb. The rise in the salt concentration of the tubular fluid reaching the ascending limb further stimulates sodium and chloride transport within the ascending limb. This phenomenon is called countercurrent multiplication. Countercurrent because the tubular fluid in the ascending and descending limbs travel in opposite directions, and multiplication because the positive feedback relationship multiplies the effect on water reabsorption in the descending limb and sodium and chloride transport in the ascending limb. The countercurrent mechanism performs two services for the kidneys. First, it is an efficient way to reabsorb solutes and water before the tubular fluid reaches the distal convoluted tubules and the collecting system. Second, it establishes a solute concentration gradient that will permit the passive reabsorption of water from the fluid in the collecting system as the collecting ducts pass through the medulla.
The urinary system is our friend. No matter how many times it wakes you up in the middle of the night, remember, the urinary system is working for you. Its main job is to constantly remove waste from our bodies by forming urine. It also maintains normal blood composition. So just like a water purification plant filters bad stuff out of water, the urinary system filters waste from the fluids in our bodies and returns good stuff to our blood. The whole urinary system is made up of a pair of kidneys, a pair of ureters, a single urinary bladder, and a single urethra. We'll tackle the kidneys first.
Section A, the kidneys and urethra.
The kidneys are two bean-shaped organs. They're located in the superior lumbar region, an area discussed in the Anatomically Correct World of Anatomy, Part 1.
There are three regions in the kidney: the outer renal cortex, the middle renal medulla, and the inner renal pelvis. The kidneys are responsible for removing nitrogenous waste. That's waste that contains nitrogen. The kidneys remove these wastes by forming urine. This maintains a healthy acid-base fluid balance in the blood.
The main structures that make up the kidneys are tiny blood processing units called nephrons. They are the functional units of the kidneys, the workhorses, you might say. These little nephrons carry out the processes that form urine. And who could ask for a more fulfilling job?
There are over 1 million nephrons in each kidney. Each nephron is made up of a renal corpuscle and a renal tubule.
The renal corpuscle is responsible for glomerular filtration. Glomerular filtration is the first process in urine formation. The renal corpuscle is made up of two structures, the glomerulus and another structure called the glomerular, or Bowman's capsule.
Now, while the glomerulus may sound like a race of different-looking, and therefore evil, creatures from Star Trek, it's not. The glomerulus is actually a small tuft of capillaries. The glomerulus is surrounded by a capsule which is attached to the renal tubule, a structure that we'll give you the details on in just a moment.
The glomerular, or Bowman's capsule, is the other part of the renal corpuscle. Basically, it's a large cup-like structure that completely surrounds and engulfs the glomerulus, kind of like how a broken-in baseball glove engulfs a baseball. And don't forget, Bowman's capsule and the glomerulus also form the renal corpuscle, and it's in this section where the filtration of blood takes place. To sum it up, inside the renal corpuscle, bad stuff go bye-bye.
Just remember that the renal corpuscle is in charge of the glomerular filtration. You don't have to know that much detail, because hey, this is anatomy, not physiology. In any event, you do know about the glomerulus now. But still, that's only one of the structures that makes up a nephron. Another structure is the renal tubule.
The renal tubule's job is to selectively reabsorb water and substances like sodium, potassium, calcium, and other important stuff that's needed by the body. It also secretes waste no longer needed by the body.
The renal tubule is divided up into three regions.
These regions are the twisty-turny proximal convoluted tubule, the U-shaped loop of Henle, and the twisty-turny distal convoluted tubule.
The proximal convoluted tubule, or PCT, is the highly coiled region of the renal tubule that is continuous with the glomerular capsule.
Connected to the PCT is the loop of Henle. The loop of Henle is a hairpin loop that links both convoluted tubules, the PCT, and the distal convoluted tubule, or DCT for short. The portion extending from the PCT is called the descending limb of the loop of Henle. The portion connected to the distal convoluted tubule, or DCT, is the ascending limb of the loop of Henle. The distal convoluted tubule, or DCT, emerges from the loop of Henle and forms the final region of the renal tubule. In all of these tubules, water continues to be absorbed and waste continues to be deposited.
We're not going into detail on the formation of urine, so don't feel like you're missing anything. If you want to know more about urine, send a self-addressed stamped envelope to Fun with Urine, 2890 Emma Lee Street, Falls Church, Virginia, 22042. You'll be glad you did.
Well, that's the end of the renal tubule. Now, I know there's a lot of confusing loops, tubules, twists, and turns in the renal tubule, but that's because the extra length these curves create allows the renal tubule to process waste more effectively. More surface area means more filtration. So, do yourself and the renal tubule a favor and rewind the tape if you're confused or need a review.
When the urine formed in the renal tubules exits the DCT, it's delivered to a collecting duct. The collecting duct collects urine. Wow, what a great hobby.
The collecting duct collects urine from the DCTs of a whole lot of nephrons. You see, the millions of nephrons in your kidneys all have DCTs that empty out into collecting ducts. These collecting ducts deliver the urine to the renal pelvis. Then it flows into a ureter. Remember, each kidney has a ureter, so you have 2 ureters. But unfortunately, before we move on to the ureters, we have to talk about severe kidney disorders.
Sometimes, when a lot of nephrons are damaged or can't function right, a condition known as renal failure occurs. When this happens, people have to undergo dialysis, where they are placed on a machine called a dialysis machine.
Hemodialysis is the most common form of dialysis. In this process, blood is rerouted through a machine that contains a semi-permeable membrane suspended in a bathing solution. The membrane removes wastes from the blood and traps them in a bathing solution. Important substances the body needs can re-enter the blood from the bathing solution. Sometimes, in cases even more severe than this, a kidney transplant is required.
It's true. Renal failure is frightening. But never forget, all those other times when your kidneys are working, that's renal success. And now, on to the ureters.
There's not really much one can say about the ureters. They're really thin. They conduct urine from the kidneys to the urinary bladder. Pretty simple, huh? Now, the kidneys are an important part of the urinary system, but the precious urine they create would have no place to go were it not for the worm-like ureters, the cavernous urinary bladder, and the muscular urethra.
Section B, the urinary bladder and the urethra.
The urinary bladder and the urethra are the last few rest stops for urine on that highway of relief.
The bladder is a collapsible muscular sac that lies just behind and below the pubic symphysis. The pubic symphysis is the cartilage that connects the 2 sides of the pelvis. The bladder's prime job is to temporarily store the urine that's constantly being produced by the kidneys.
The next adventure on the urine itinerary is the urethra. The urethra is a muscular tube that transports urine from the bladder to the outside world so that everyone can enjoy it. All people.
The urethra contains 2 muscular structures called sphincters. It has an internal urethral sphincter made up of smooth muscle. The internal urethral sphincter is under involuntary control, meaning you can't control it consciously. The other sphincter in the urethra is the external urethral sphincter. It's made up of skeletal muscle and under voluntary control. We'll go into more details on the sphincters in a sec. Just let us elaborate on the urethra for a bit longer.
At 8 inches, the male urethra is a lot longer than the 1.5-inch female urethra. The male urethra also conducts urine and semen, while the female urethra conducts only urine. Well, that's the bladder and the urethra. You should be thankful for these organs. They make micturition, the act of emptying the bladder, possible.
You see, when the bladder fills up with urine, its smooth muscle contracts, causing the internal sphincter to open wide.
So if you're not ready to go because you're in church, running a road race, or dancing with your prom date, your body helps buy you some time.
We can use our external sphincter to temporarily delay the release of urine. You know, hold it in. This is because the external sphincter is under voluntary control.
Unfortunately, this little trick can only work for so long because the external sphincter will eventually give way to building pressure and then Niagara Falls. But hey, we're lucky we even have the ability to hold it in, and sometimes we take it for granted. Urinary incontinence is the inability to voluntarily control urination.
Urinary incontinence is normal in infants because babies haven't developed control over their voluntary external sphincter.
Unfortunately, incontinence in adults is usually caused by emotional trauma, pressure from the uterus during pregnancy, and nervous system disorders like multiple sclerosis. So if you're healthy, be thankful for your healthy urethra, as well as your bladder, kidneys, and ureters. By Job, be thankful for your entire urinary system, even on those cold winter nights when nature calls.
We have evolved on a watery planet. In our everyday lives, we try to make sure we're never far from a supply of water. The human body can lose water in many different ways. On a day trip like this, through one of the hotter parts of the world, father and daughter will both place great demands on their body's water control systems. Their bodies are really a filter for fluid, in one end and out the other. In between the two ends, their bodies will sweat, breathe, eat, drink, and urinate. Each of these ordinary human activities will affect the inside of the body by adding or subtracting water. On the whole, it doesn't matter too much if we take in extra water, but the body soon suffers if we lose too much. If the body's water content drops, it's not long before we start noticing the effects. After a 5% loss, we become very thirsty, 10% and we're very ill. And if water resources drop 20% or more, we die, with 30 or more quarts still left in the body. Our internal fluid is salty, like the sea. Perhaps this is a reminder of the fact that fish were our remote ancestors. In fact, the balance of chemicals in body fluid is very close to the composition of seawater, but much more dilute. The way our cells work now depends on the right balance of sodium and chloride, and that means salt. Salt plays a vital part in the workings of the body, and it can only do this if it's carried in just the right concentration in the fluid that bathes the cells. It could mean disaster for these red blood cells if the salt in the surrounding fluid were too concentrated or too dilute. These cells are swelling up because the concentration of salt outside the cell is lower than inside. As they lose their disc-like shape, they could eventually burst and spill their contents. If there's too much salt around the cells, they suffer an equally disastrous fate. The pressure difference causes them to start to collapse. The cell membrane becomes crinkled, and they're unable to do their job. To avoid such a drastic state of affairs, the body has an early warning system, the feeling of thirst. Thirst is triggered as the blood becomes increasingly concentrated. There are many substances that are dissolved in our blood, minerals, hormones, food molecules, and so on. If we didn't drink when we needed to, other activities could cause our water level to drop. Sweating and urinating, for example. As we lose water, the dissolved substances become packed more closely together. It's this greater concentration of the blood that gives an early warning of danger. If we don't replace the lost water, the level in the blood will continue to drop. We don't usually take an active interest in the concentration of salts in our blood, but we're all familiar with the sensation of thirst, which is just the body's way of warning us that its cells might be in danger. Father and daughter are on their way to visit friends, so they know they won't have too long to wait for a drink. Or will they?
I don't know what's wrong with this thing.
Unfortunately, in these conditions, the body can lose water very quickly, and many of its activities use up precious water supplies. Muscle contraction, for example, generates heat and increased sweating. Because he's breathing more heavily, he loses more water in his breath. If there's no water to replace these losses, his blood will become more and more concentrated and lead to a greater and greater feeling of thirst. The sensation of thirst begins in this tiny area of the brain. The blood flows past nerve cells that taste its saltiness. If it's too salty and needs to be diluted, the nerve cells alert other parts of the brain and produce the feeling we know as thirst.
Have some water.
There is, in fact, more than one type of thirst. He felt thirsty because he had lost a lot of water. But she feels thirsty because she ate too much salt earlier in the day. Like her father's blood, hers has also become more concentrated, but for the opposite reason. In fact, there's a daily need for salt just as we need a certain amount of water. Many foods have salt in them, and the taste itself can be quite attractive in moderation. Mealtimes play havoc with our water balance, since we usually take in both salt and water when we eat. And there's one further factor. All this steak and French fries are going to need powerful digestive juices to break them down, and that uses up some of the body's internal water supplies. Digestive juices are produced by cells which extract water from the blood and pump it into the digestive tract. But when this water is taken from the blood, salt goes with it. So we're losing water from the body, but the saltiness of the blood doesn't change. This means that the thirst centers in the brain aren't affected. They only detect increased saltiness. And yet a loss of water on its own does produce thirst. We often feel thirsty when we eat, for example, because we're using up water to digest the food. There are other detector cells for this type of water loss. In the walls of the heart and large blood vessels, there are cells which signal if the body's fluid level drops. This also leads to a strong feeling of thirst and makes sure we replace the fluids we've lost. This alarm system is most useful when we lose a lot of fluid due to bleeding. Massive hemorrhage can lead to a strong feeling of thirst, as the body alerts us to the need to replace the fluid quickly, before the heart fails.
Oh, you get so thirsty out here. It's so hot.
Yeah, we'll stop here in a few minutes, Dolly.
For humans, drinking is not just a means of topping up the body's water supplies. We get pleasure from it, and like eating, drinking has a social function. Animals seem to lack this social lubricant. Like man, they have specific appetites for water and salt, but they don't seem to get the same pleasure we do from drinking more than they need.
Is that a dun color, Tully? No, it's Palomino. That one there? Yeah.
When animals drink, they only take in enough to replace what they've lost. They seem to have an accurate water meter, with the ability to judge exactly how much they've taken in at any time.
Okay. Davia, let's go. I'll see you later. Take care.
If we take in too much fluid, sooner or later there'll be an easy and familiar way to get rid of any excess. While we can take in water at any time and in any place, we're more choosy about when and where we get rid of it. The main voluntary means of getting rid of extra water in the body is by urination.
Hey, good to see you. Yeah, hey. Hi, I'll be back in just a few minutes.
The buildup of urine and the way we excrete it are under the control of a system that allows us a lot of freedom. Although there are times when, if you've got to go, you've got to go. The fluid that leaves the body is a very different composition from anything we might have drunk. As we can see with this optical technique, it's at body heat and is much more like one of the other body fluids. It's full of dissolved chemicals, most of them molecules that would build up to harmful levels if we didn't get rid of them. It even has a few surprises, like these beautiful urine crystals. These are merely the end products of some of the chemical activities in our tissues. The formation of urine starts in the blood. The blood plasma needs to get rid of excess water and waste molecules, but they're mixed up with many useful substances that the body needs to hold on to. It's this system, the kidneys, ureters, and bladder, that deals with the complex task of removing from the blood just those components we don't need and excreting them. These images use radioactive blood to trace the path of the urine as it's extracted in the kidneys, seeps down the ureters, and builds up in the bladder. As the blood flows through, the kidneys perform a remarkable feat. They seem to be able to pick and choose what to take out of the blood and what to leave in. The kidneys are acting like a filter, but they're rather cleverer than a normal filter like this sieve. Here, anything smaller than the holes in the sieve passes through, and larger objects are held back. But our kidneys are able to put back substances after they've slipped through the holes, if we need them in the body. We have two kidneys, which provide more than enough tissue to do the job. We could actually get by with less than a third as much. Their position in the body reflects the crucial role they have in filtering the blood. They lie very close to the main artery and vein that run down the middle of the body. With every heartbeat, the kidneys receive a quarter of the body's blood supply. The blood is forced into the kidney through a system of blood vessels that return it to the main circulation after it's been filtered. In the course of a day, the blood flow through our kidneys is as much as 200 times our total blood volume. This means that 1,000 quarts of blood passes through them every day. If the kidneys had to filter the contents of this swimming pool, they'd do it in a couple of months. If the kidneys were an ordinary filter, they'd hold on to the larger components, like red blood cells and hormone molecules, and let through everything smaller. This would include many useful substances like salt and glucose, which would be washed away in the urine. Instead, the kidneys have developed this clever filter that can save these useful substances and put them back in the body. These patterns in the kidney mark out a series of closely packed tubes, each of them dealing with a single droplet of blood. At the start of each tube is a basket of tiny blood vessels through which fluid under pressure leaks out of the blood. This is really the nearest thing to a sieve in the kidney, because it does have tiny holes that let through molecules below a certain size. There are more than 1 million of these in each kidney, and their total surface area in the body is nearly 10 square feet. Stretching away from each sieve is a tube, the nephron. The fluid that's to become the urine squeezes through the sieve at one end and travels along this tube. In fact, a nephron is not stretched out straight, but follows a hairpin path from the sieve at one end to the main urine ducts at the other. The nephron is hugged all along its length by blood vessels, waiting to take back some of the ingredients of the urine. As the liquid travels down the nephron, it's still carrying useful molecules like glucose, the red squares. The glucose molecules are small enough to slip through the sieve, but we can use glucose for energy, and it's recaptured. It passes through the walls of the nephron and back into the bloodstream. This system is usually very efficient. More than 99% of the glucose that tries to escape is put back into the blood. There are two other important substances the body tries to retrieve as the urine is being formed. One of them is water, and this has a useful relationship with the other, salt, which means they can both be conserved at the same time. When the salt is in the blood, it's in a dissolved form rather than in crystals like these, so its molecules are small enough to slip through the sieve at the top of the nephron, along with the water that carries it. As it travels along this tube, the salt receives the same sort of treatment as the glucose we saw earlier. It's pumped out of the nephron back into the bloodstream. Here, the green squares are the salt. This time, an interesting thing happens. The water, the blue dots, follows the salt back into the blood. In this way, the kidney recaptures both salt and water at the same time, making sure we don't lose too much of either. By the time the fluid is flowed from one end of the nephron to the other, the kidney has recaptured many useful substances and put them back into the bloodstream. So efficient are the kidneys that about 99% of the volume of fluid that flows through them is put back into the blood. The remaining 1%, a quart or so a day, will head towards the bladder and the outside world. Up to now, he's not really aware of any of this complex activity in the kidneys, but the next stage will occupy more of his attention. The kidneys and bladder are part of the body's waste disposal system. Many of the chemical activities that go on in the body give off byproducts, industrial pollution if you like, and the body uses our excess water to carry them away. The rate at which we build up urine varies with the temperature. On a hot day like this, the kidneys don't produce as much urine as when it's cold, because the body gets rid of a lot of water by sweating. The way the system gets rid of urine is a much simpler business than the filtration in the nephrons. It's really a straightforward bit of plumbing. 5 separate lobes of the kidney trickle their urine into this space. The tiny amounts of urine from each nephron gather together and emerge into the center of the kidney. Here, waves of contraction start to pump the urine towards the bladder. The urine leaves the kidneys along the ureters, the 2 tubes that lead to the bladder. Here, inside a living human, we can follow the path the urine takes from the kidney to the bladder. After about half a cup of urine has trickled into the bladder, we start to feel a sense of pressure, although not so strongly that we need to urinate. As more urine pours in, it stretches the bladder walls. They contain a special type of muscle that helps us avoid too much discomfort by only warning us now and then that the bladder is getting fuller. In this way, we are gently reminded of the need to urinate, rather than constantly harassed by an expanding bladder. The increased pressure closes off the exit from the ureters and prevents the urine flowing back towards the kidneys. More and more urine trickles in until the bladder contains more than a cup and a half. At this stage, the bladder will start sending more urgent messages to the brain.
Boy, I gotta go to the bathroom.
From now on, he'll have less choice. The bladder can hold a maximum of just under 2 cups before things start to feel painful. The final stage in this process is to relax the muscles at the exit of the bladder and allow the urine to leave. In men, the urethra, the tube from the bladder to the penis, is quite long, 8 inches or so. In women, it's only a little over an inch. That may be why women are more prone to bladder infections than men, because bacteria from outside have a shorter journey. Men also have to squeeze muscles in the urethra to get rid of the remaining urine. But in women, the shorter urethra empties by gravity alone. When we release the muscles at the exit of the bladder, the pressure in the muscular walls pushes out the urine. In a few seconds, the bladder collapses as the urine rushes down the final pathway to the outside world. In a man, there's one more useful design feature. The final inches of the urethra give a useful spin to the urine as it emerges from the penis, rather like a bullet from a rifle. This helps to contain the urine in a neat and purposeful stream. For all of us, water input must balance water output. By eating and drinking, we look after the input. By sweating, breathing, and urinating, we carefully adjust the output. And the purpose of all this is so that the body's cells can get on with their everyday activities in a calm and peaceful internal environment without being poisoned, drowned, or dehydrated.
The major structures of the female reproductive system are the 2 ovaries, 2 fallopian tubes, the uterus, and the vagina. A normal female is capable of reproducing from the onset of menstruation during puberty until the end of menopause. The female is fertile and able to become pregnant approximately during the 13th and 14th days of each menstrual cycle. The total number of eggs a woman will produce in her lifetime are present in her ovaries when she is born. Each month at the beginning of a menstrual cycle, the pituitary gland secretes the follicle-stimulating hormone, which is commonly known as FSH. This hormone stimulates one egg to mature with an ovary. The maturing egg is surrounded by a Graafian follicle. On the 13th or 14th day of the menstrual cycle, the Graafian follicle ruptures and releases the mature egg from the ovary. Because the fallopian tube is not attached to the ovary, the finger-like fimbriae must catch the egg and guide it into the fallopian tube. After the release of the egg, the Graafian follicle changes and becomes the corpus luteum, which secretes the hormone progesterone in preparation of the lining of the uterus to support a pregnancy. If the egg is not fertilized, the corpus luteum dies and the progesterone secretion ceases. The menstrual cycle is then completed with a menstrual period. If the egg is fertilized as it travels down the fallopian tube, the corpus luteum continues to produce progesterone. The fertilized egg moves into the uterus where it is implanted. The placenta forms, and, for the duration of the pregnancy, it secretes the progesterone required to maintain the pregnancy. Throughout the 40 weeks of the pregnancy, necessary nutrients are supplied and waste products are removed by the placenta and the umbilical cord. When it is time for the baby to be born, the pituitary gland secretes the hormone oxytocin. This hormone stimulates the labor contractions that result in the birth of the child. After the infant has been delivered, the final stage is the delivery of the placenta as the afterbirth. The primary role of the male reproductive system is to produce and deliver sperm to fertilize an egg in the female. These sperm are produced outside of the body cavity by the testicles, which are located in the scrotum. The scrotum protects and supports the male reproductive organs that are located outside of the body cavity. These include the testicles, epididymis, and vas deferens. The testicles produce about 300 million sperm each day. However, this is possible only if the temperature of the testicle is 93.2 degrees Fahrenheit. The scrotum maintains this temperature by adjusting how closely it holds the testicles to the body. The interior of each testicle consists of multiple lobules, containing 2 or 3 seminiferous tubules. It is within these tubules that sperm formation begins. The sperm moves out of the tubules into the epididymis, and then into the vas deferens. The vas deferens carry the sperm upward into the body cavity. After the sperm leaves the vas deferens through the ejaculatory ducts, they pass the openings of the seminal vesicles. The seminal vesicles, which are located near the base of the ejaculatory ducts, secrete a thick yellow substance to nourish the sperm. This secretion forms 60% of the volume of the semen. Semen is the sperm-containing fluid that is ejaculated at the climax of male sexual excitement. From here, the semen travels into the 8-inch long urethra, which transports both urine and semen, but not at the same time. At first, the urethra is surrounded by the prostate gland, and then it is surrounded and protected externally by the penis that is relaxed except during sexual excitement. During sexual excitement, the penis stiffens and enlarges so it can deliver the sperm into the female vagina. During the expelling of the semen, which is known as ejaculation, the prostate gland secretes a thick alkaline fluid that increases the ability of the sperm to move in the semen. Located just below the prostate gland are the bulbourethral glands. These glands open into the urethra, and, during sexual arousal, they secrete the pre-ejaculate fluid that flushes out any residual urine from the urethra. It also lubricates the urethra to help the sperm pass through. When the male ejaculates into the vagina of the female, the sperm must travel upward through the uterus to fertilize the egg in the fallopian tube.
Under the regulation of the pituitary hormones, luteinizing hormone, LH, and follicle-stimulating hormone, FSH, follicles develop within the ovary. Primordial, primary, and secondary follicles contain an oocyte that is suspended in prophase of the first meiotic division. Growth in these follicles is due to an increase in the number of granulosa cells. Secondary follicles develop an antrum that contains the secretions of the granulosa cells. Within the mature follicle, the first meiotic division is completed. A sharp increase in the LH level stimulates ovulation. After ovulation, the remaining granulosa cells and surrounding cells form a corpus luteum. If pregnancy occurs, the corpus luteum is maintained. If pregnancy does not occur, the corpus luteum slowly degenerates to form a corpus albicans.
In human females, oogenesis, or egg formation, takes place within the ovaries. Each ovary contains diploid cells called oogonia, derived from embryonic germ cells. Before a woman's birth, the oogonia divide by mitosis. The result is more oogonia, some of which develop into primary oocytes. Primary oocytes are immature egg cells contained within masses of cells called follicles. The primary oocytes then enter meiosis I. This process stops uncompleted until puberty. No primary oocytes are formed after this point, At birth, each female has a finite number of primary oocytes available for reproduction. At puberty, a complex series of hormonal events stimulates changes in the surrounding follicle and induces some primary oocytes to complete their first meiotic division. The division of cytoplasm and cell organelles is unequal, however. As a result, one large secondary oocyte and one small polar body form per primary oocyte. The polar body often degenerates. The follicle containing the secondary oocyte continues to mature until a surge of the hormone LH initiates ovulation. The mature follicle ruptures, releasing the secondary oocyte. At this point, the secondary oocyte has entered meiosis II. This second meiotic division will not be completed, however, unless fertilization occurs. The secondary oocyte enters the oviduct, where fertilization of the oocyte with a sperm cell can occur. The entry of a sperm cell into the cytoplasm of the secondary oocyte triggers the completion of meiosis II. The cytoplasm divides unequally, generating a mature ovum and a second polar body. The fusion of the haploid sperm cell and the haploid egg cell has produced a diploid zygote.
Spermatogonia are the cells from which sperm cells arise. The spermatogonia divide by mitosis. One daughter cell remains a spermatogonium, and the other becomes a primary spermatocyte. The primary spermatocyte divides by meiosis to form secondary spermatocytes. Secondary spermatocytes divide again to form spermatids. The spermatids differentiate into sperm cells.
Let's compare spermatogenesis with oogenesis. Both processes start before birth, when embryonic germ cells differentiate into spermatogonia in the testis of a male, or oogonia in the ovary of a female. Both types of cells are diploid. However, whereas mitotic divisions continue to generate new spermatogonia in the male until death, in the female, the generation of more oogonia by mitosis halts well before birth. Although spermatogonia develop into primary spermatocytes throughout life in the male, in the female some oogonia develop into primary oocytes, but only before birth. Males can continue to produce viable sperm from puberty until death, but females can produce viable eggs only from puberty until the supply of primary oocytes is depleted. Meiosis I does not begin until puberty in the testis of the male. Meiosis I begins before birth and ends at puberty in the ovary of the female. Meiosis II occurs within the testis at any time from puberty until death in the male. Meiosis II begins within the ovary only at ovulation in the female and ends within the oviduct upon fertilization by a sperm cell. The final result of spermatogenesis is 4 haploid sperm cells for each spermatogonium. In contrast, oogenesis can result in 1 egg cell and 2 polar bodies for each oogonium, but only if fertilization has occurred.
Hello and welcome to Healthy Nation. I'm Pat Murphy. The human reproductive process is delicate and complex. It can seem like an absolute miracle when a new life is born. Whether you're trying to conceive or not, the key to family planning is knowledge and preparation. In this segment, we'll shed some light on how reproduction works, and we'll give you some tips on how you can help guide the process. Let's go to Dr. Isabel Blumberg with an overview of how reproduction works.
Each month, a woman's body goes through a cycle to prepare itself for a potential pregnancy. This cycle is called menstruation, and it lasts on average 28 days. but it can vary, lasting from 21 to 35 days. The menstrual cycle actually begins when the uterus sheds its lining through the vagina, resulting in what is commonly called your period. So the day bleeding begins is day 1 of your cycle. At this point, hormones from the brain trigger the development of eggs in the ovaries, which in turn produce estrogen. Only one egg fully matures within a protective sac, known as the follicle, and it continues to produce estrogen. This estrogen causes the lining of the uterus to thicken and to prepare for pregnancy. The mature egg is expelled from the ovary about 14 days after the cycle begins and starts its journey down the fallopian tube. Throughout the month, a woman's cervix produces mucus. At about the same time the egg is released, the cervix produces additional mucus. If a woman were to have sex at this point, this mucus would help nourish the man's sperm and help move them towards the egg for fertilization. If fertilization occurs, this newly formed embryo will travel down the fallopian tube to implant in the uterus and pregnancy begins. If fertilization or implantation doesn't happen, the cycle begins again, and the egg is flushed out when the uterus sheds its lining at the beginning of a new menstrual cycle. Each step of this process needs to fall into place just right for pregnancy to occur. Women hoping to conceive can increase their likelihood of getting pregnant by learning about their individual cycle and knowing which days of the month they are most fertile. If you are trying to become pregnant, you can consult your doctor. She will help determine your ovulation time and address any specific health concerns you may have. If, on the other hand, you are sexually active but don't want to become pregnant, there are many birth control options available. These include the barrier methods, hormonal contraceptives, IUDs or intrauterine devices, natural family planning techniques, and permanent surgical procedures. You'll want to talk to your doctor about which might be right for you and consider the risks, effectiveness, and your lifestyle. By knowing how pregnancy works and by learning about your individual cycle, you can better plan and prepare for your future.
It's important to learn about your body and to know your options when it comes to family planning. For more information on pregnancy, birth control, or sexual health, watch our other segments in this area. Thank you for being a part of Healthy Nation. Hello and welcome to Healthy Nation. I'm Pat Murphy. Without the use of some form of contraceptive, 85% of sexually active couples can expect to be pregnant within a year. Some of the most popular and convenient contraceptives are barrier devices like condoms and diaphragms. Each of these have their own unique benefits and drawbacks. Dr. Isabel Blumberg is here to explain.
Barrier contraceptives all work by stopping sperm from reaching an egg and therefore prevent pregnancy. There are several types of barrier devices: the male and female condom, the diaphragm, the sponge, and the shield. When choosing a birth control method, it's important to consider certain things, like effectiveness, health risks, and whether or not they protect against STDs. You'll also need to be comfortable using the method for it to work well. To get full protection from any of these barrier devices, you'll need to use them with a spermicide. Spermicides inhibit the movement of sperm, and they come as gels, creams, or foams. The most well-known barrier is the condom, which you can get without a prescription. Condoms are unique. They are the only birth control method, other than abstinence, which also protects against spreading STDs, or sexually transmitted diseases. This is why condoms are frequently used with other forms of birth control. Male condoms are put over an erect penis to prevent sperm from entering the vagina during sex. When used correctly, they are 89% effective. Female condoms are inserted into the vagina before intercourse and are 79% effective. Condoms are disposable and can only be used once. They can tear, and some people are allergic to latex condoms, but plastic or polyurethane are also available. The diaphragm is another barrier device. It is a small disc that you insert into the vagina and fit over the cervix. The diaphragm holds spermicide in place to prevent fertilization. The diaphragm must be inserted before intercourse and left in place for 6 to 8 hours after sex to ensure proper protection. The diaphragm is reusable and with proper care can last for up to a year or two. When used correctly, a diaphragm is 85% effective in preventing pregnancies. This may not be right for everyone. Some people may be allergic to latex, so the diaphragm could cause a reaction. And in rare cases, women may be subject to toxic shock syndrome and vaginal or urinary tract infections. To get a diaphragm, you'll need to visit a doctor and be measured and fit for the right size. There are two over-the-counter methods that are similar to the diaphragm. They are the sponge and the shield. They are also inserted into the vagina before sex and fit over the cervix and work with a spermicide to prevent sperm from reaching an egg. These also need to be left in place for 6 to 8 hours after intercourse to ensure protection. The shield is reusable and can last for up to 6 months. It can be left in place for up to 48 hours and is 85% effective in preventing pregnancy. The sponge is disposable and can only be used once. It's 84% effective when used properly. Remember, there are many things to consider when choosing birth control, and you'll want to talk about it with your partner and your doctor to determine which is best for you.
If you're sexually active, barrier methods can prevent an unintended pregnancy and, in some cases, even STDs. Check out our additional segments about other forms of birth control to see if one may be right for you. Hello and welcome to Healthy Nation. I'm Pat Murphy. Since the advent of the pill, hormonal birth control has been one of the most popular ways to avoid pregnancy. Most people think of hormonal contraceptives as the pill, but these days they come in a variety of pills and other types of devices that use hormones to help prevent pregnancy. Dr. Isabel Blumberg has more on these options.
Hormonal contraceptives offer highly effective, reversible pregnancy prevention. These methods use the hormones estrogen and progestin. They work by preventing ovulation and implantation of an egg and increasing mucus to hamper sperm mobility. When choosing a birth control method, it's important to consider certain things like effectiveness, health risks, and whether or not they protect against STDs. You'll also need to be comfortable using the method for it to work well. Hormonal contraceptives require a prescription and come in a few different forms. Here's a breakdown on each. Oral contraceptives come in both an estrogen-progestin combination and as progestin only. Pills must be taken daily, so this requires some discipline and planning. It's a good idea to pinpoint a time to take them, say each day at breakfast or just before bed. This keeps the concentration of hormones constant and provides consistent protection. These hormones regulate your menstrual cycle and allow for monthly periods. Some types can reduce the number of periods you get per year or eliminate them altogether. Progestin only, or so-called mini pills, are useful for women who are breastfeeding or who cannot take estrogen. Aside from pills, there's the patch. It works on a monthly cycle and is an adhesive bandage which gets placed on the skin and releases estrogen and progestin into the system over time. It needs to be replaced each week for 3 weeks a month. Another device is the ring, which releases both estrogen and progestin. You insert it into the vagina once a month. There are some long-acting methods for those who have health concerns related to estrogen or who are concerned about remembering daily or weekly routines. Progestin shots provide 12 weeks of pregnancy prevention and are administered by a health professional. And finally, there are implants, which are inserted under the skin by a doctor. These release progestin over time and provide up to 3 years of protection. They do have some possible side effects like hair loss, ovarian cysts, loss of sex drive and appetite, and possible infection at the site of the implant. All these hormonal contraceptives have some things in common. They all provide a 92 to 99% success rate when used as directed. And when stopped, fertility usually returns to normal in 1 to 2 months. Their effectiveness can be diminished if taken with some other medications, like certain antibiotics, over-the-counter drugs, and some herbal supplements like St. John's wort. No one birth control method is perfect, and none of these protect against STDs. And they all come with certain risk factors. The estrogen-progestin combination has an increased risk for blood clots, stroke, and heart attack. And they shouldn't be taken by women who are 35 or older and smoke, have a history of heart disease, a family history of blood clotting disease, are breastfeeding, or a history of certain cancers. Some of these also have benefits, like lowering your risk of certain cancers, improving acne, preventing severe menstrual cramps, and decreasing menstrual bleeding. As with all contraceptives, there are pros and cons you'll have to consider. Talk to your partner and your doctor when deciding which is best for you.
There are a lot of birth control options out there, and it's important to learn about all of them. Check out our segments in this area and see which may be right for you. Thank you for being a part of Healthy Nation. Hello and welcome to Healthy Nation. I'm Pat Murphy. If you're not ready to have a family but have had unprotected or forced sex or fear that your birth control method may have failed, there are options available to help prevent an unintended pregnancy. Dr. Isabel Blumberg is here to explain in detail what you can do.
Emergency birth control are methods used for preventing pregnancy after a contraceptive method fails or after unprotected sex. It prevents pregnancy by inhibiting ovulation, fertilization, or implantation. The key is timeliness, because emergency methods cannot prevent a pregnancy once it has begun. You'll need to act within 72 hours following unprotected sex for emergency birth control to be effective. It is best to contact your doctor or go to a family planning clinic as soon as possible to determine which method might be best for you. You might also need to ask whether you need to be tested for sexually transmitted diseases. So, what are your emergency options? First, there are hormonal oral contraceptives, sometimes referred to as morning after pills. They need to be taken within 5 days of having unprotected sex and can prevent fertilization and implantation. They are the same hormones used in traditional contraceptive pills, estrogen and progestin. Your doctor can explain how to use the traditional pill in this way, or they come prepackaged in the correct dosage and can be purchased over the counter. They are 79 to 85% effective. It's important to note, these pills are not abortion pills. They cannot reverse a pregnancy, but if taken in time, they can prevent one. Another type of emergency contraception is the copper intrauterine device, or IUD. Your doctor would need to insert the IUD into your uterus within 5 days of unprotected sex. The IUD would prevent implantation of an embryo. This method is 99% effective at preventing pregnancy. Emergency contraception is not meant to be used as your primary birth control. It's important to find a long-term method that you can use consistently and properly.
If you're sexually active and aren't ready to have a child, it's vital to learn all you can about what contraceptive methods are available. Check out our additional segments about other forms of birth control to see if one may be right for you. Hello and welcome to Healthy Nation. I'm Pat Murphy. Deciding when and if to start a family is a big decision, and it's one that takes care and planning. Natural family planning, or fertility awareness, is sometimes used by couples who are hoping to become pregnant, but it can also be used as a form of birth control. Dr. Isabel Blumberg is here to talk about how it works.
Natural family planning, or fertility awareness birth control, requires fully understanding a woman's fertility cycle in order to be effective. But not all women should use it. If you have irregular periods, you should consider another form of birth control. This also may not be right for you if you have just given birth or are breastfeeding and still have an irregular cycle. The idea is to closely track a woman's menstrual cycle and to either avoid having sex when she is most fertile or to use a barrier contraceptive like a condom or diaphragm during this time. This method is 75 to 99% effective in preventing pregnancy when done perfectly. And that's the trick. In order for this to work, you need to be vigilant about tracking the menstrual cycle. Let's look at how this works. Ovulation occurs when an egg leaves the ovary and moves into one of the fallopian tubes, where it can be fertilized by sperm. The egg will live for about 1 day once it's released. Figuring out when this is likely to happen is the key. There are several ways to track your fertility, and you should practice and take notes for a few months before relying on this as your only birth control method. The first is called the calendar method. The first day of the period is considered day 1 of the cycle. Typically, if a woman is cycling normally, she will ovulate between days 13 and 15. You can also take your temperature every morning before you get out of bed with a basal body thermometer. Mark it on a calendar. When it rises and peaks, it's an indication that the egg has left the ovary and you are in your fertile window. Changes in the amount and consistency of cervical mucus can also help you predict fertility. You'll need to note the days when you have the most mucus and it's slippery and stretchy to determine what days you'll need to abstain. There are also over-the-counter devices that test saliva and urine for signs of ovulation. These kits measure hormone levels, which are higher around the time of ovulation. They will let you know when you're most fertile. These natural planning methods really require you to give yourself a window of 3 days before and after these tracking methods suggest that you are ovulating. That's because a woman's cycle can vary from month to month. So that's why you'd need to abstain or use alternative birth control for about a week to protect against an unintended pregnancy. It's really easy to make mistakes with the natural family planning method, and it doesn't protect against STDs. So if you're going to use it, talk to your doctor, who can help you learn to accurately track your cycles so you know when to use other birth control or abstain from sex.
This fertility awareness method is a great natural form of family planning. It works, but only when it's done right. So don't leave it up to guesswork. Talk to your doctor and learn how to do it well. Check out our other segments on birth control to see if one may be right for you. Thanks for being a part of Healthy Nation. Hello and welcome to Healthy Nation. I'm Pat Murphy. Most birth control methods are temporary and reversible and have a degree of uncertainty to them. If you've come to a point in your life where you know you don't want to have children in the future but are sexually active, you may want a permanent form of contraception. Dr. Isabel Blumberg is here to explain the various types available.
Both men and women can undergo surgery to permanently prevent the possibility of pregnancy. This is not to say that all the procedures are irreversible, because some are. But unless you choose to undergo a second procedure to reverse it, it will remain in place throughout your life. For men, there is a vasectomy. A surgeon either ties off or blocks the vas deferens in the scrotum to prevent sperm from being ejaculated during sex. It takes several months for the procedure to have its full effect. But once completed, a vasectomy is more than 99% effective at preventing pregnancy. Reversing a vasectomy is possible with additional surgery. For women, there are 2 methods. First is tubal ligation, more commonly known as getting your tubes tied. A surgeon actually cauterizes or seals the fallopian tubes with a plastic clip or ring. This prevents an egg from making its way from the ovary to the uterus, and it also stops sperm from entering the fallopian tubes to join with an egg. Reversing tubal ligation is possible in some cases. Generally, though, if you do change your mind and want to become pregnant after having this surgery, you'll likely need to do so through in vitro fertilization, or IVF. The other option for women is the insertion of metal coils into the fallopian tubes. These coils cause scar tissue to develop in the tubes and block the passage of eggs and sperm. This sterilization procedure is not reversible. Both tubal ligation and coils are more than 99% effective in preventing pregnancy. These can be good options for people who know they don't want to become pregnant but want to stay sexually active. These procedures are not always reversible and should be considered carefully with the help of your doctor and partner.
If you're sexually active and aren't ready to have a child, it's vital that you learn all you can about what contraceptive methods are available and to determine which are best for you and your partner. Check out our additional segments about other forms of birth control to see if one may be right for you.
To understand the various ways that medical science can assist reproduction, it is important to understand how the reproductive system functions in both sexes, because the cause of infertility often lies equally with both men and women. The main players in the female reproductive cycle are the pituitary gland, the ovaries, and the uterus. Their activities are closely coordinated. Each month, one or other ovary releases a single egg, an event known as ovulation. It is brought about by a series of complex interactions between the pituitary gland, the ovaries, and the uterus. The pituitary gland is itself under the control of this small area of the brain known as the hypothalamus. A new menstrual cycle begins when the nerve cells of this center secrete a hormone called gonadotrophin-releasing hormone, GnRH, into the network of blood vessels which surrounds the pituitary gland. Stimulated by pulses of gonadotrophin-releasing hormone, cells in the pituitary gland secrete another hormone, follicle-stimulating hormone, or FSH. FSH travels in the bloodstream, reaching the ovaries. There it stimulates the formation and growth of an ovarian follicle in one or other ovary. The follicle consists of an egg, a number of surrounding cells which secrete estrogen hormones, and fluid. FSH helps the egg to mature and prepares it for release. As the follicle matures, the hypothalamus increases secretion of GnRH. This in turn stimulates the pituitary to secrete a second hormone which acts on the ovary. This is luteinizing hormone, or LH. Toward the middle of the cycle, there is a sudden peak in the blood level of LH. This acts as the trigger for ovulation. Within minutes of its release, the egg is guided by suction through the fringed opening of the outer end of the fallopian tube, starting it on a journey which will take 5 or 6 days as it passes down the tube and finally reaches the cavity of the uterus. Meanwhile, after the follicle ruptures, it is converted into this yellowish body known as the corpus luteum. Cells of the corpus luteum secrete the hormone progesterone, which brings about important changes in the lining of the uterus, preparing it for possible pregnancy. In fact, the lining of the uterus, known as the endometrium, undergoes changes in response to hormone levels during the cycle. In the first half of the cycle, known as the follicular phase, the developing follicle secretes increasing amounts of estrogen hormone, which encourages regeneration of the endometrium. After ovulation, there are important changes in the endometrium, aimed at making it suitable to receive a fertilized egg. These changes are brought about by a secretion of progesterone from the corpus luteum. The secretion of progesterone is maintained for several days, but if the egg is not fertilized in that time, the corpus luteum withers, and falling levels of progesterone and estrogen trigger the shedding of the uterine lining as the menstrual flow. The cycle then starts again. But if the egg is fertilized, no menstruation occurs, as the corpus luteum continues to function, secreting progesterone during the first 3 months of the pregnancy. Thereafter, numerous changes occur to support the developing embryo.
Whether you really want to make a baby or are petrified that you're pregnant, your first step will most likely involve taking a home pregnancy test.
To get the most accurate result on a home pregnancy test, it helps to know how the test works and when you should take it. Quite simply, a home pregnancy test detects the presence of a hormone in your urine called human chorionic gonadotropin, or HCG. HCG is a pregnancy hormone that a woman's body starts producing when a fertilized egg implants in her uterus. In most women, this implantation and subsequent HCG production occurs up to 6 days after sperm and egg meet. Because of this, many women will get the most accurate result if they take the home pregnancy test a full week after their missed period. Although many tests claim that they are 99% accurate as soon as the first day your period is due or earlier. That's because some technically pregnant women may not have experienced implantation by this day in their cycle. Plus, the amount of HCG that a woman makes may be so minute at first that a home pregnancy test won't be sensitive enough to detect it. When you do take your home pregnancy test, you'll get the best results if you test first thing in the morning when your urine is the most concentrated. Since tests work in various ways, make sure to read the instructions and pick the one you think will work best for you. Whatever the test results say, you should still take another pregnancy test in a few days to confirm. This is partly because of the extremely unlikely chance that your test will say you're pregnant when you're actually not. This false positive result can occur if you had a miscarriage or abortion in the past 8 weeks or if you're taking certain fertility drugs. More common are false negative results, where the test says you're baby-free when you're actually pregnant. False negatives are often the result of taking a pregnancy test too early or not following the test directions. Additionally, you could get a false negative if you drink a great deal of water pre-test, in turn diluting the amount of HCG in your urine. If you do get a positive result, make an appointment with your doctor to confirm the pregnancy. Your physician will probably take a blood test to measure HCG in more minute amounts than the home pregnancy tests are able to. Your doctor may also confirm your pregnancy with a sonogram. If you are indeed pregnant, prenatal care should begin right away.
Okay, everybody, take a break, 15 minutes. Okay, this is the review for the final exam. There will be questions on here that you'll see both in some form on the regular final and also in some form on the extra credit block. This is basically a silent movie. You get 40 seconds to try and answer the question, and what will happen after that is that the question answer will follow. So if you have the answer, by all means volunteer it and get ready to do a little Q&A. And after this, that's the end of the presentation, and we can call it a night. So we begin.